of this course, I would like to congratulate all my colleagues. And during the time of this 20 weeks of this, the classes followed by our a beautiful exposure. I must say that, especially clinical exposure, which has been given in the CMC. I am really grateful for that. I have learned many things like rephrasing, especially for me, because I was in the mission hospital for almost 18 years. But when I come up to the government setup, it was almost, I'm going to complete 10 more years. So in that, because my knowledge and especially my skill also, it was little bit like stagnant type. But still, when I joined this course, I really feel grateful for those people who have given information to me, and I feel that it must be refreshing for my knowledge. And at the same time, as the nurse leader, that we should upgrade our knowledge. Then when I remember about our older classes, like because it was little bit long ago, but of course, in the like we start writing in the notebook, like what are the every chapter, like Ma'am Nightingale has make us to see that every chapter that you write, that three things that newly you have learned, all those are very. When I opened the notebook, I was really grateful to open all my notebook and keep it here. So it's a very, I must say, and again in the middle, I am just saying that CMAI. I'm really grateful to the CMAI as a whole and the CMC Valor distance education as a whole, like leading by Madam Nightingale and the nursing superintendent and everyone who has guided us. Besides, there are all the busy schedules that I really appreciate their work, which I have seen. So thanks one again, and God blessing be upon each one of you. And when we talk about the every speaker, which or resource person who has been shared their great knowledge, like I must say that the program and the discourse was well structured and informative course also at the same time, and the session was very highly enriching, and each module provided to us this valuable knowledge and practical insight, especially for me, like when I opened like infection control and all those things. It's really grateful for me to learn to apply in my setup. And when especially would like to once again thanks Ma'am Nightingale also, that every in the starting for the modules and all, it anytime when we ask in the group or anytime when we call, Ma'am was ready to help us and guiding us in the initial, of course, little bit of away from the computer and also, but we learn through this course a lot, and I never find any difficulty afterwards. In the starting, some difficulty was there. So for the great coordinating as a coordinator, Ma'am, once again I thank you so much. And when I remember about our speaker, like Ma'am, firstly I would like to mention that Ma'am Mercy Zone has speak about leadership style, because Ma'am, as I have met her quite longer, many times I have met her in the CMEI also. I really like her style of means her style of talking and her leading, because I didn't work with her, of course, but in the class also I have really can remember all her example when in the decision making and all those things as a part of leadership style. I'm really thankful to Ma'am also as a resource person which Ma'am has guided, and along with Sir Dr. John Ahmed also, because in his all the three sessions, I remember it's really a great privilege for us to learn the communication, and also like when we talk about the mission and vision, all those things, it was a very grateful practical experience that from his expertise he has shared with us. Thank you so much, sir, for that. And for Sir Victor Emmanuel, he has also uh, explained us about the work-life balancing, how we are going to balance our life. Because in the most of us, we thought that we don't know how to prioritize things, but how to balance our work-life balance. In that also, we have learned a lot. And again from Ma'am Bindu, has insightful session on the stress management. Ma'am has taught us about in the session with the great expertise from her area of or field of experience. Thank you so much for Ma'am also. And next, I would like to say about Ma'am Bina Matthew for her session with the patient safety, because especially when we are in the clinical, like those simple example, and when we had a great discussion on that, and with the material which is provided, and in the module was really helpful for the patient safety. And I would like also to express uh, excellent session, I must say, for the bioethics, because ma'am, I have met one session once I met ma'am in the Dimapur, I think, but I really wanted to from that 1 hour of the her session, I would really wanted to listen from her. But thank God that ma'am has taken a good number of session with all the structure, we must say the clear, and it was very clear and very structured and in the very engaging manner. And ma'am has a good area of expertise, because in her field also, especially when we talk about the bioethics, mostly in the OBS and gynae cases also, we have faced many things. We have a lot of confusion on that, but ma'am has cleared all our this one confusion which we have. And the session was really a thought provoking, I must say. And also we all are encouraging from the ma'am session. And I would also like to say from the ma'am Bedalina, she has taken the session on the legal implication in nursing, because as a nurse, like when we are the second, like we are following with the doctors and the consultant with their this one, especially when we are in the clinical, we able to understand, we able to face that this all the legal and the ethical and legal implication. But ma'am has again revised us and renew our thought on that. And the session was increase again awareness, and we developed confidence from her session. We have learned that many good new things from the in the nursing implication also. And especially I would like to say that Ma'am Ellie Sony has excellent session, I must say. I think in one of our participant, my colleague also already said in that, budgeting is really, we thought that budgeting means it's quite boring. I also feel like that, but ma'am has made us very interesting, and it was really, we learned a lot from the ma'am's class of the budgeting and uh, valuable financial planning, how we are going to allocate in the different area, which we really learn from ma'am. Thank you, ma'am, so much. And overall, all the speaker are very coming with a lot of, especially clinically, and also they have a lot of experience in their field. And I also would like to say that our respected ma'am Simi Matthew also, and ma'am Nightingale, they have in our discussion classes and different area of, and also ma'am has come all the way to meet us in the CMC. For Simi Matthew, ma'am, again, once again, I thank you. And also, maybe I may miss somebody according to what because today only I was just looking through, because I'm not able to remember. I feel that I covered all, but overall, all of the classes which we got was excellent. All the speaker, I must thank Ma'am Nightingale and Ma'am Simi, ma'am, again. Thank you once again.
Good evening, everyone. I'm Albert, basically from Tamil Nadu, now working in College of Nursing in AIMS Patna. First of all, I thank God for His grace in helping me and us successfully to complete this fellowship in nursing management. I want to tell you about this course. Is truly enriching, and it's very transformative journey. It changes me a lot. It brings out my mistake where I'm doing the mistake. I think so. It's for everyone. It is a transformative journey. It has strengthened it's strengthened my and our knowledge in especially in leadership and planning, decision making, and in nursing administration. I want to tell about the course. Actually, the content of the course is well structured, especially the modal pages. The content was really structured, relevant. It is very comprehensive. It covered the overall aspect, essential aspect of the nursing management administration. And I don't want to repeat again, as Tadaima was saying, the session was taken by the resource person, was highly informative and inspiring. The teaching is not like high tech. It is really based on the real life experience and real life scenario and very practical applications. So I still remember all the classes because it was being taught by only the practical and real life scenarios, which helped us to clearly understand the concept and apply them effectively in our workplace. Thank you for all the resource person who have been gathered here and who have taken the class. And I want to thank the posting at CMC Vellore is a highlight of this program. It provided excellent practical exposure to the real-time hospital management, teamwork, leadership practices, and dual responsibility, which has truly enriched our learning experience. And I would like to special thank to CMC Value for providing this valuable learning opportunity and exposure. And special thank to the CMC Nursing Superintendent of Nursing Service and Dean of Nursing Education Service team. And thank you everyone at CMC Value. And this fellowship has a program has been improved my and our confident communication skills and ability to take up the leadership more effectively. And I would like to sincerely thank CMI Nurses League, all the resource person, faculty members, coordinators for their continuous support and guidance. And above all, I give all glory to Lord Savior Jesus Christ for guiding us throughout this journey. Thank you all.
Thank you for sharing the valuable experiences. And I know all of us want to speak and give their experience, but it was given to people. So all that covered, and we had new friends, and our contacts number increased. We had definitely a good time of learning along with other good experiences in the practical areas. A few things which we have not seen, we have learned, and few things what they follow, we have learned because of the mixture of people. Thank you so much, ma'am, for actually helping us to, get into this course, the team. And thank you, Thadai ma'am, as well as Albert sir, for giving your experiences to us. Thank you. Now it's time, though it is online, the most awaited moment for all of us who admit ourselves to one course and get the certificates. Though it's virtual, this moment is equally joyful and meaningful. So I request all the colleagues of mine, please turn on your video and acknowledge when you present your certificate. Over to you, Shmi ma'am.
Good evening, everybody. It is my honor to present to you the graduates, the candidates who have successfully completed their online short course on fellowship in nursing management. You heard the report. It went over 4 months, and we appreciate the perseverance of the candidates in completing all the modules and also coming for the posting, CMC posting from across the country. So I would like to present the candidates, and as Sandhya said, if you can come on video and acknowledge, it would be nice. I will also present their name and where they are from, so we would get a comprehensive picture about where all we from, which all places we had the candidates. So this is Tanushri Biswas. She's a tutor in College of Nursing, AIMS Kalyani. So Tanushri, are you there?
Yes, madam.
Okay.
Thank you so much, madam, for your continuous support and motivating us. And after means so many months, we have got this certificate after so many doing things like module and then assessment part. So continuously we have, sometimes we have got troubled and then contacted to you and then you have solved it. So lots of thanks, and CMAI also. Thank you so much, madam.
Thank you, Tanishri, and congratulations. Next, we have Dr. S.K. Mohana Sundari. Ma'am is assistant professor at College of Nursing, AIMS, Bibin Nagar, Telangana. Mohana Sundari, ma'am, are you there? Okay. The next person is Mr. Albert Blessing. We saw him. He is based at AIMS Patna, and he's a tutor there in the College of Nursing. Congratulations, Albert.
Thank you, ma'am. Thank you. Thank you all.
Next, we have Rashmi P. Nayak. Rashmi is a ward in charge in the Tiruvalla Medical Mission in Kerala. Rashmi, are you there?
Yes, ma'am.
Okay, congratulations, Rashmi.
Thank you, ma'am. Thank you so much.
Next, we have Priya Lata Marath. She is the Deputy NS at Sri Ramachandra Medical College in Chennai from Tamil Nadu. Ma'am, are you there, Priya Lata Marath? Okay, congratulations. Next, we have Mrs. Sanjita Sapna Masi. She is a Deputy NS at Padar Hospital in MP. Sanjita, ma'am, are you there? Okay, we'll move on. Next, we have Mrs. Anjali Samville. She's a staff nurse and supervisor at Padar Hospital in MP. It's a mission hospital. So, congratulations, Mrs. Anjali Samville. Are you there, Anjali Samville? Next, we have Ramya.rosalind, principal from School of Nursing, CSI Mission Hospital, Trichy in Tamil Nadu. Ramya, ma'am, are you there?
Yes, ma'am. Thank you so much, ma'am. Thank you, ma'am.
Next, we have Mrs. Idai Khani. She is a deputy NS from Catherine Booth Hospital in Nagarkoil in Tamil Nadu, again one of our mission hospitals. Congratulations, Idai Khani, ma'am. Are you there?
Yes, ma'am. Thank you, ma'am. Thank you so much. Thank you for all this. Thank you.
Next, we have Mrs. Matilda Arun Mary. Matilda is also from CSI Mission Hospital, Trichy, and she is a tutor based there. Congratulations, Matilda.
Thank you, Shimi ma'am and Nightingale, for your constant support and guidance. Thank you.
Congratulations. Then we have Sonia Pius. She is a tutor in the A&M training school in Port Blair in Andaman and Nicobar Islands. Sonia, ma'am, are you there? She was there, yes. Sonia? So maybe network issues. She had joined the meeting. Congratulations, Sonia.
Yes, ma'am. I'm there, ma'am.
Yeah, congratulations.
Thank you, ma'am. Thank you so much.
Next is Conifer Kamaki. She's principal, Bethany School of Nursing, Shillong, Meghalaya. Conifer, are you there? Okay, congratulations to her. Next, we have Sandhya from, again, Mission Hospital, Karigiri in Tamil Nadu, near Vellore. So, congratulations, Sandhya.
Thank you, ma'am. Thank you.
Then we have Reena Jennifer, again from Karigiri, a staff nurse. Reena, are you there? Okay, we'll move on. Then we have Arambam Tadoi Chanu. She's from the ESI hospital, government hospital in Shillong in Meghalaya. We saw her speaking. Tadoi, congratulations.
Thank you so much, ma'am.
Then we have Mrs. S.P.L. Padma Kumari. Ma'am is from a private college, associate professor in a private college of nursing in Andhra Pradesh. Ma'am, are you there? Congratulations. We will move on. Next, we have Prativa Manjari. Prativa is a principal in the College of Nursing, Christian Hospital, Katak. So, congratulations, Prativa.
Yeah, thank you.
Then we have Mercy. She is the nursing superintendent of Greenland Institute of Nursing in Manipur. Mrs. Mercy, are you there?
Yes, ma'am, I'm here.
Congratulations.
Thank you, ma'am.
So these were our candidates, and congratulations to each one of you for successfully completing the course. Over to you, Albert and Sam.
Thank you, ma'am. A big congratulations to all the fellow beings. May God continue to guide you as a compassionate leaders in nursing. Thank you. Thank you, Shimi ma'am, too.
Now is the time for clarification. The Bible reminds us, give honor to whom honor is due. Romans 13:7. Let us now move to the felicitation of our esteemed guest. On behalf of Christian Medical Association of India, I would like to invite our dignitaries to share a few words one by one. First, I invite Dr. Ronald General Secretary, Christian Medical Association of India, to kindly address the gathering. Over to you, sir.
Thank you, Albert. On behalf of all the staff of CMAI, Christian Medical Association of India, I would like to extend my heartiest congratulations to all those who have completed the fellowship in nursing management. It is very encouraging to hear from you of your feedback and that all the efforts that have gone through in preparing for this fellowship in nursing management has to hear that it has been successful. So thank you very much and a big congratulations. And we know that you will go, you will make difference in wherever you are. You will make a difference to the people that you are in contact with. You will make a difference to the people that are around you. So we would like to wish you all the best in the future, and then we would also like you to promote the fellowship in nursing management to your colleagues as well, so that more people will be able to come and do this course. It's wonderful course, and especially this time, I would like to congratulate Nightingale and Shimi as well for the third batch, and we already have a very full fourth batch coming up in the future as well. So, big congratulations to both of you. And I would like to also mention at this point, Dr. Priya John, the previous general secretary, whom I took over from, because it was part of her effort for the Nurses League of CMAI to introduce this course as a blended learning. So thank you, Priya, for all the effort as well. And at this time, I would like to again wish you the very best in your future and a big congratulations. And we are so grateful and so proud of you from CMAI side as well. So congratulations once again. Thank you.
Thank you, sir.
Thank you, sir, for your encouraging words. And next, I would like to invite Head of Department, CMC Vellore, Department of Distance Education Unit, to share a few words. Over to you, ma'am.
Thank you very much. And respected dignitaries who are here, thank you, CMAI, for coming up with this wonderful program. And congratulations to all of you nurses as you have completed the FNM program. I always say whenever somebody embarks on doing a distance or blended learning course, it is a great commitment because you're working full time and you're adding on the studies and attending the sessions and doing the homework or the assignments that are there, taking time out. And I believe that each one of you have come into the course because you felt that it would be something that equips you, gives you an additional edge as you continue to serve. And it's my prayer that each one of you would find that the things that you've learned are things that you can put into practice in your workplace and be a blessing. I think nurses have such a beautiful privilege of being there at the bedside and caring for the needs of the patients. And especially as Christian nurses, we have the love of Christ to show them. And what is already in our hearts is now going to be also sharpened with the skills that are needed to lead and manage well. So I pray that each one of you will be a blessing to your colleagues and to the institutions where you belong to. It was wonderful to hear all the different hospitals and nursing schools that each one of you represent. And I know that whatever you have learned will trickle down to others who are there as well. So I thank you so much for this. I would like to thank CMAI for the privilege of working together on this distance education unit. We enjoy the partnerships that we have because we recognize that it's through this that we can multiply what we do. And so really thank you to Mr. Nightingale, it's just Shimi, who've been working closely with us. I have one of my colleagues, Mrs. Nemi Margaret, is here with us from our tech team. And it's always a joy when we celebrate the completion of a course, and we hope that we will continue to work together to equip many more. Finally, I'd like to close with one of my favorite Bible verses as just as a promise to each one of you. It's from Second Corinthians 9, verse 8. And Paul says, "And my God is able to make all grace abound to you, so that in all things, at all times, having all that you need, you will abound in every good work." So congratulations once again, and may God bless you all.
Thank you, ma'am, for your valuable, encouraging, and blessing words to us. Now, I would like to invite Mrs. Alice Soni, TMC Balu, to address the gathering. Over to you, ma'am.
Greetings to all in the name of our Lord and Savior Jesus Christ. It's truly a joy to be part of this program today. My sincere thanks to CMAI for taking the lead in organizing and conducting this course. I also thank each participant for choosing to be part of this meaningful journey. And we thank God for the opportunity given to Nursing Services CMC Velo to be an integral part of this program. And today, your feedback has been really very encouraging, and we are glad that we have been able to be part of this program and also to enrich in your learning. And it's our prayer that many more Christian mission institutions and leaders, both in the government and private sectors, will take up such courses in order to invest in leadership development. Though many of the topics are very familiar to every one of you and you have learned it, this coming together to learn definitely would have been refreshing and enriching, and it will equip you to expand God's kingdom through servant leadership and also by becoming efficient leaders and managers in the places that you are called to serve. And we hope that each participant who leaves this program will be strengthened, inspired, in order to give your best in the respective roles that you are playing in your respective places. And especially in today's context where hospital administration is increasingly being taken over by those with management degrees, we as nurses must rise to the occasion. Who can understand patient care, a ward, and hospital functioning better than us? Yet somewhere it is lacking, and if this is the need of the hour that this course has been conducted and you're able to participate in it. Because most of the time, why others are taking over us is because we've often pulled ourselves back, maybe due to the lack of creativity or limited critical thinking, and sometimes we're very comfortable with certain age-old practices. So we are called to be change agents, not to simply follow the cut, copy, paste approach, but to think for our own institutions, innovate for our own hospital. For that, we need to read more, stay updated, and to grow with latest knowledge and practices, latest terminologies in management, which is also very important these days because management, other management degree holders are thinking very differently these days. And we as nurses who are very familiar with this hospital setup need to even more think more differently for our own institution. So I encourage all the participants to reflect deeply on this aspect. If we are to remain relevant as caregivers and nurse leaders in clinical settings, we must be willing to grow, adapt.
Asking.
With this, I want to congratulate each one of you for successfully completing this course. Best wishes and God bless all of you. Thank you.
Thank you, ma'am, for your inspiring words and the word of advice. And surely we'll make a change in the. We sincerely thank to all the dignitaries for their presence and guidance. Thank you all.
First Thessalonians 5:18 says, "In everything give thanks." So I now invite Shalini who's the Executive Assistant, Nurses League CMAI, to deliver the vote of thanks. Over to you, ma'am.
Thank you, Sandhya. So now this is a time for Thanksgiving. And first of all, actually, the Lord Almighty, we should thank Him for each and every privilege, His grace, wisdom, and guidance throughout this batch. And also would like to thank our General Secretary of CMAI, Dr. Rona, for offering facilitations on behalf of CMAI and all the support. We thank also Dr. Priya, our former GS, for her encouragement and support for this course. We would like to thank NL Chairperson for welcoming the gathering and for the support and guidance to the Nurses League. We would like to thank Dr. Adeline Shetter, HOD of CMC Distant Education Department, for offering facilitations and for all the support from Distance Education Department for this course. We would like to thank IT team of CMC Distant Education League, Mr. Divya Kumar and Mimi Margaret, for their constant support for the course. We would like to thank Mrs. Alice Soni, the nursing superintendent of CMC, and her team for taking care of our candidates during practicals exposure and providing a meaningful experience for the candidates. We thank Ms. Alice Ma'am for attending today's program and offering facilitations on behalf of the nursing service at CMC. We would like to thank resource persons of the course. Why not only the taking sessions, but pass on the passion of leadership to our candidates. We would like to special thank to Dr. Rupa Verghese for taking sessions on bioethics, which is highly appreciated by the candidates of each batch. We would like to thank the participants. They are actually important part of this program, actively engaging in live sessions and completing the modules successfully on time. We would like to thank CMA staff. We would like to thank Mr. IT, admin, finance department, communication department, RCOs for promoting and the support for conducting the course smoothly. And of course, Ms. Nightingale, the course coordinator, for her passion and hard work in making sure everybody complete the module and engaging in review of modules with the candidates. And last but not the least, Ms. Simi Matthew, the main, the pillar of this program, who has taken lots of pain and gone up extra miles for this program. Thank you so much, Shimi ma'am, and to all. Thank you, everyone. Over to you.
Thank you, ma'am, for the heartfelt vote of thanks.
As we conclude, let us remember the Lord make his face shine upon you. It's from the Bible, number 624. Congratulations once again to all the third batch of fellowship and nursing management. Thank you all for joining us this evening. Stay blessed and continue to serve with compassion and excellence. God bless you all. Thank you.
Okay, we need to take the group pic. So can you all please turn on your video so we can take the group pic? Please turn on your camera. I will just put it in a gallery mode and take them. Thank you all. Thank you all for turning on your camera. Okay, broad smile, please. Smile. I don't know where the person is. Reshmi ma'am. Nimi. Okay, one more.